Hey guys, so I turned my camera on to kind of update you guys on what our next steps are in our infertility journey. Thank you to all of you guys who have been so constant in our lives during this process and just always wanting the best for us. We did come up with a very big decision. Sorry if you hear the laundry. I'm doing a lot of laundry right now. But yeah, we decided to try IUI round 1. It's a very big decision that we made. It was something that I never really imagined we would have to do. After we met with the fertility doctor and going through all of that, she said we can just continue and trying naturally if we want. I think I've mentioned before, she doesn't think that with our diagnosis, unexplained infertility, along with our age and all our lab values, that we really need to do IVF. She did say IUI might be a better option. So we just kind of wanted to do something, now it's been over 2 years and maybe seeking fertility treatment is the special path that we need to take to become parents. So we decided to just give it a try. I'm not saying that we're going to be doing IUI round 2, 3, going into IVF. I'm very unsure about what will happen after the first round of IUI, but yeah, that is our decision. And I wanted to share that with you guys along with kind of going through what my fertility doctor has taught me about what IUI is. Yeah, I just thought I would kind of show you guys what this would look like for us the next couple weeks to a month. So this is something that she sent me. I'm not making this up and I am not a professional in this area, but I'm just going to be sharing with you guys what my IUI cycle will look like with this clinic when and if I start my period. I mean, hopefully I don't start, but if I do start, I have to call on day 1 of my period to the doctor's office. I will go in to do more blood work. Once again, so much blood work these days. Even if we're planning on doing this, if my hormone levels are all whack, then I might not be able to do IUI even. So I will go in and they will be doing a blood test, also an ultrasound. So they say that this is between days 2 to 4. So while I am still on my cycle, and then they will prescribe me letrozole, which is a hormone medication. And normally this is used for like breast cancer. So I am a pharmacist, so I do know what these drugs are. Yeah, basically it's a hormone med to make me ovulate. So I don't have a problem with ovulating. I ovulate every month. This will just make sure that everything is going to happen according to the plan. I'm taking a medicine called letrozole for 5 days by mouth once a day. I've seen a lot of YouTube videos on people doing IUI and being on letrozole, and a lot of people complained of headaches. So that's something that I'm a little bit afraid of because I'm prone to headaches, but we'll see how it goes. Maybe I won't have any side effects. So I'll be on letrozole for 5 days. Then I go in for another ultrasound. And this is where they measure my follicle size and how many follicles I have, how many eggs they think I will have, and all of that. So I will go in for that ultrasound. And all in this process, they will be ordering me a trigger shot, which is a shot that they give me to make sure that I ovulate. I think it's between 24 to 36 hours. I believe that's what it is. I am extremely afraid of this because I hate shots. Even when I was in pharmacy school, I hate receiving shots. I hated giving shots, but I got a little bit more accustomed to that. But regardless, I just hate shots. So I'm really scared of this, especially because it's in the stomach, which I feel like it would be more sensitive than just like in your arm, So I'm a little bit afraid of that, but we'll do that. And then we do the IUI right after that. I think they're gonna call me and tell me exactly what time frame. They're doing all the calculation based on my follicle size. So we are gonna be going in for the IUI. I think my doctor explained to me that it's like the day before ovulation, I think is how she explained it to me. And then we have a 2-week wait, and then we do the beta test, which is a blood test to see if I am pregnant or not, because yes, pregnancy tests are accurate, but the most accurate way is to do a blood test, and I think they need it for their data on the hospital part. So that is what the cycle looks like. So going back to the laundry's done. But going back to the letrozole, I think there are 2 meds you can take, either the letrozole or the Clomid. I have done my research on it, and I felt like a lot of data and a lot of the what do you call those, clinical trials that I saw said that Clomid actually ended up with a lot of long-term side effects and like possibly even cancer. So I was hoping that I wouldn't be on Clomid, and then she gave letrozole. Not saying that letrozole is any better, I don't know, but just from what I've seen that I think they prefer letrozole over Clomid when doing IUI. So I'm glad that my clinic is using letrozole. And I wanted to also go into the insurance part of it and how that worked, because I know that for a lot of you guys who are thinking about it, IUI, IVF, any fertility treatment, it's not cheap. And of course, all of this depends on your insurance. And it depends on your insurance. It depends on the state, because I know that some states don't really coverage on your fertility treatments, your insurance. But I know that Illinois is one of the states where insurance, I think there is some kind of coverage. But obviously, this depends on which insurance you have or which insurance plan you have even. So with mine, they're covering up to $25,000 of fertility treatments and $10,000 on the meds. So like all the injections and things like that. This is for a lifetime. It's not every time I'm trying to have a child. I have a case nurse that I'm assigned to by my insurance, and I kind of just talk to her about things, and she guides me through this whole process. So she is the one who told me when the doctor's office orders the trigger shot, have them order that early on, so that if it's too expensive, then we have enough time to just switch to another med or maybe switch another pharmacy that will cover it more for me. So that's something that you guys should look into too. Like I call my insurance to see how much will you guys cover for fertility treatments and all of that. Yeah, so far it's been a smooth ride. My case nurse is super awesome. She gives me a lot of tips on like at least like the financial aspect of it. She always wants to see if emotionally I'm doing okay. So the trigger shot will be covered through insurance, but obviously this also has to do with how much of a deductible do you have left, what's your copay, all of that. Everything is like case by case, but I think that we have a good enough insurance plan where they do cover a lot of it, like a good chunk of it. And price-wise, IUI is obviously a lot cheaper than IVF. IVF can get very, very expensive. And that's kind of why I said that I need to be smart about it, because I only have a $25,000 budget, kind of, like how much insurance will cover. So I don't want to waste it all on IUI when I'm like, oh shoot, maybe I should have done IVF. And this is only because IVF has a higher success rate than IUI. And my case nurse has also told me she wouldn't recommend more than 3 cycles of IUI. Maybe think about IVF after that. So yeah, I think the maximum amount of times I would do IUI is 3. But we'll just see how the first one goes. Because if it's like a really bad experience, I don't think I would want to continue. So IUI is a very simple process. IUI stands for intrauterine insemination. They take your spouse's sperm, or it doesn't have to be a spouse, it can be a donor. So they take the sperm and they wash and spin it. I don't know what this machine is, but they basically just take the ones that are good, the ones that are alive, and they inject that into you by using a catheter that they insert similar to SIS. So that's also something I'm a little afraid of, because SIS is extremely painful for me. Yeah, they connect a catheter into your uterus and then they inject the sperm so that it goes like right there, and all it needs to do is travel to the fallopian tubes and meet with the eggs, instead of having to go through the vagina, then the cervix, then the uterus into the fallopian tube. It's kind of doing the physical work for you. Yeah, I am kind of afraid. Can you guys leave in the comments below if you guys have experience with this, or if you guys know friends who have gone through this, like how they felt with IUI, if they also thought it was easy process, or if they just thought it was also very hard, because I'm going into it thinking it won't be that bad, but I also I don't know if it will be. And I feel like this whole process has been so difficult for me, because SIS is something that's supposed to be so easy, but it's not for me. So I'm just a little afraid of how it's gonna go. But yeah, leave in the comments below if you guys have any tips or anything to say about IUI. That's where we kind of are. I'm excited yet nervous, because I just never saw myself in a position where I needed to get fertility treatment. So I think that part, getting over that part to come to this decision, was the hardest for me and Chino. But I think we truly want a child, which is why we are willing to go through this. I am very afraid of IVF because of all the shots and all the hormones and just all the things that I have to go through that will be painful, number one, but just like, I feel like it's just gonna drain me emotionally, drain me physically, and I don't know. I don't know if I was ready for that. So for now, we are doing IUI, and then if things don't go well, maybe we will be doing IVF by the end of this year. And that's where we're kind of at. Yeah, it's been a whirlwind of emotions and things that we went through, but I hope that these videos are helping some of you guys to just feel like you're not alone, and also feeling like you can relate to me, and yeah, just getting to know me as well too. Like, things aren't always perfect in my life, and we are going through this, even though medically it says we should be able to have a child naturally with no problems, but and our ages are young, and you know, these are just things that life throws at, and you just have to deal with it and go through. I hope you guys enjoyed this video and at least learned a little bit of something out of it, because that's what I always want you guys to get out of my videos. Like every single shorts, every single video, I want there to be something that you guys can take away. Make sure to keep up with me and check out the next video, because that will just kind of be the whole process of me doing IUI, or maybe there won't be any video because I'll just get pregnant or something, which probably won't happen. But yeah, I'll see you guys in our next video.